More Joy is about that. We're very proud to have Louise as our ambassador. We would like to start with some questions and engaging the public as well. So, Paula, you're welcome to start, and thank you very much.
Muy buenos días a todos. Welcome, everybody. Good morning. Don't worry, Louis. The interview is going to be in English. We'll switch to English because we have a lot of international visitors. I am Paola Rojas. I'm a Mexican journalist, and I am honored to be here this morning. And when I say this, I mean this. I am very honored to be surrounded by people who create life. I do not only respect what you do, but I celebrate it. I wouldn't be a mother myself if it wasn't for scientists, medical doctors. So I do appreciate what you do every day, every minute of your effort, researching and, helping us to build a family. I'm personally very thankful. So it is an honor for me to be here and to support all this movement. And of course, support Louis, who's a very interesting birthday lady. Did you enjoy your birthday? Uh, we had a chance to celebrate with her last night, and it is also a celebration to have you this morning with us, Louis. I would like to talk to you to begin this conversation from a different perspective. You've always been the daughter, of course, of your parents, but you're also somehow the daughter of science, uh, even the daughter of hope and possibilities for thousands of families. But I would like to talk to the mother this time. Would you share with us how your life changed when you became a mother?
I I think it really brought home to me when I became a mum for the first time what actually my mum went through to have me. I don't think I fully appreciate it, although I've had it all my life. I didn't fully appreciate the feelings and what it feels like to actually have your baby in your arms, and it's just magical. And if we can help every want to be mother to feel that way, then I just think it's amazing.
Of course, it is a transforming experience, right?
Yeah, definitely. Like I said, I didn't fully understand before, but as soon as you sort of give birth or have your own child, I don't know, something changes, and you sort of look at them, and they're part of you. You've grown them for 9 months. It is magical.
It is magical and it is wonderful, but it is not an easy journey for every family. Your own have to try very hard. Did your mother share with you her own fertility journey?
There were certain things that she shared. I mean, like you said, it was no easy journey. There was no support. There was nothing back. When my mum went through it, she couldn't tell anybody because it was sort of not a secret, but they didn't want the whole press. I mean, it was bad enough as it was. Before I was born, there was a bomb scare because the press wanted to get mum outside just to get pictures of her. So she said sometimes it was pretty scary. I mean, after she'd had the first operation to remove her fallopian tubes, they did a round trip from Bristol, which is where we live in the UK, up to Manchester, which is where Bob and Patrick and Jean were doing their work. It was a 400-mile round trip on the train, and she got back and all her wound stitches had come open and she was bleeding everywhere. And my dad said to her, "Come on, Leslie, we don't need to carry on this." And she said, "Yes, I am, John, I'm carrying on." And she was quite a determined lady. I I don't know if she was here today, she'd be amazed to see all you guys out there doing what you do, helping create families. And I just think she'd be amazed by it all.
And of course, they tried very hard, but we can tell that it was worth it. You're here.
Yeah. Not sure growing up she felt that way sometimes, maybe a bit, but yeah, no, I mean, they were both wonderful parents. I think they did a brilliant job. They didn't ask to be put out into the spotlight. They didn't ask. They just wanted a baby. And I think they coped with it pretty well. And I think they've done an okay job at bringing me and my sister up.
So we're talking about how magical and wonderful it is to bring a baby to the world and raise a child. And still, the fertility rates are declining. How does that make you feel?
Makes me feel quite sad. But I mean, eventually, if they keep declining, there's going to be nothing left. And this is why I'm really pleased to support the More Joy campaign, to help try and bring the fertility rates back up.
And this is where I ask you all to share as well, because I think that we need to, work hard together, like the different sectors, so that fertility rates stop declining, especially in the Western world. So what will you tell me about the governments being part of this effort? Yourself, Louis, or please. Duncan.
Yes. Well, in some parts of the world, there's been some experience with policies that governments have implemented. For example, in Singapore, some countries in Southeast Asia that have really low pregnancy fertility rates since the 80s and 90s. So they have supported family building policies through bonus packages, also through parental leave, flexible parental leaves. And they have, in some cases, have some success. But even when you remember, China had a one-child policy and then they changed it to a two, and they haven't been able to revert. Even in China, fertility rates are lowering now. So it's an effort that, and the fertility part of that is a small proportion, but it's also the voluntary childlessness that we are interested in exploring. What are the reasons that youngsters don't or are planning to have or no children, or maybe one child, and that's what we are trying to learn about. We are planning a worldwide survey targeted at universities and trying to understand the process, because society has changed in all these years. And now the fertility treatments are not only for infertile patients, also for same-sex couples, for anyone needing treatment because of genetic diseases, etc. So we need to advocate for all these populations to have access to care, because we need to have coverage for those people that need it. But also we are intrigued about the fact that society is changing, and maybe there's some reasons that we don't know. We think it's economy, housing problems, financial constraints, maybe nuclear threats, fear of climate change. All of those reasons are. There's a recent publication of the UNFPA unit that has shown that youngsters, if they had the opportunity and the possibilities and the support, they would like to have children. So that's the More Joy campaign is about the joy of building a family and learning about these changes in society.
I think that just one woman desiring to become a mother or a couple desiring to become parents should be reason enough to help them through that process. But there is also economical reasons to work hard together so that these birth rate does not keep declining. Do you want to talk about it? Like all these effects in the society, in a country, if the birth rates keep declining? Please, doctor.
Thank you. I believe we understand this poorly. We do not really know what makes the young generation focus on other parts of their life. I think it's probably the legacy of being focused on contraception for the last 50, 60 years, which was grossly unbalanced by a lack of education on fertility. And many times when we see, I'm sure this is your experience too, when you see a lady in her 40s and you give her the figures, she's always very surprised and says, I never realized my chance to conceive is this small. So we're not here with more joy to convince women and men to have a child. That's not our role. Our role, as Marco said, was first to raise awareness, because many of us don't actually know how dramatic this fall in natality is. It's actually absolutely shocking if you understand it well. Go onto our website and see we have a rotating globe, and then every single country in the world fertility rate is presented. If it's below 2.1, it means that population is falling. The country needs to have an average of 2.1 children per woman to maintain its numbers. If it's below 2.1, the country population is going down, and over 90% of all the countries in the world are below 2.1. But you don't see this on the front page. Okay, and what is in the front page in your national magazine? I don't know. It could be about finance, it could be the wars or something else, but nothing to do with human beings. So that was the first. The second one is to mobilize the other groups. The other groups meaning industry, and I'm sure there are people that support it here. Mega Labs is one that I can see that we believe have a role to play, in which they say we want to support More Joy. We want to help you send the message out. What can we do? And then it's you, each individuals. Marcus has some pins if you want to be a More Joy ambassador, and in your own hospital, university, do an interview, create some activity. And then is the politicians that we want to talk to, because they need to understand that, okay, climate change is important. But who cares about climate change if in 500 years there's no human beings on the planet? Do you care about climate change? I wouldn't care about it. So I think the focus has to be on humanity, on who we are, and then, as Marco said, to go in and understand why the young generation prefers to spend time playing video games instead of going in and saying, hey, how are you doing? Do you want to go out with me tonight? Let's have something to drink. What is your passion? Create a relationship, fall in love, dream of a baby. Okay? Yes. So thank you.
Thank you. Thank you, doctor. And you're right. It is not out there. It is not on the media. I can collaborate with that. Hopefully next Monday, breaking news, the fertility rate is declining.
And we all need to say, okay, thank you for telling me. And I think education of the young people, 25 to 35, and being told you can be the president of the Mexican Republic even at 70, but you cannot become pregnant at 70 with your own eggs. So have a block when fertility is important, and also the ambition of, being somebody and going up in your career. I think this is instilled in our children, but I also think in the family we need to say to our daughters and boys. I only have one child. Sorry, I'm not contributing to the growth of population. My apologies. But we need to educate our children to say there is something in us that makes us special. The desire to be human, the desire to have a child, the desire to put children also as an important element in our lives, as opposed to, okay, when can I buy my Ferrari? I mean, that's not that relevant. Ferrari can't smile at you really later, and goes on fire too.
It's a good idea to get to know you a little more. Do you have children here? Who's a parent here in this audience? Okay. So there's still some possibilities here. Who has 3 children? 3 kids? Okay. More than 3?
Yeah. I've got 4, so
Okay. So the rest of the questions are going to be focused here. Okay, so we have the fertility king over here to talk about this. It is not breaking news, but it is a conversation that should be out there because yes, we need to be aware of its big importance.
Can I
Of course.
something?
This is your party, Marta, por favor.
So I just want to stress the fact that in Mexico, Paula, because if you are going to give this kind of information, in Mexico, we're seeing the same situation. And currently the fertility rates, based on the latest report, are at 1.9. So, and this is, continuing to decline. We just saw how many of you rose your hand in terms of who has more than 3 kids. Like, it's a minority. That's reality.
Maybe if you break it up in different parts of Mexico, it will be different. Like in Argentina, in Buenos Aires City, it's 0.9. So probably in Mexico City, it's going to be lower than in the rest of the country. So they're closing maternities. I mean, the hospital where I was trained, we had like 100 deliveries per month. Now it's 55 at this point, and it's just 20 or 25 years ago, or maybe a little bit more. But
Now that you mentioned Mexico in the 70s, there were 7 children. Imagine. Anybody 7?
and I know.
Okay. Let's just don't go that far with the information. And let's go back to Luis. How does this declining rate fertility makes you feel, Luis?
Is actually quite worrying. Just to think if people don't keep reproducing, then there will be no one left. There'll be no one to help other people like all you guys do. It's just, I just can't imagine. It's pretty scary, really, when you actually sort of sit down and think and look at it now. It does definitely need to be out there and people, education in school. These guys, obviously, the More Joy campaign are doing a brilliant job. And I'm proud to be ambassador for them. It's just, I don't know. It is just pretty scary.
It is. It is. So I mentioned the possibility of governments helping, but there is, of course, a huge possibility as well to have the corporate sector being part of this effort. How can companies be part of this effort that you're...
Yeah, we are focusing now on that, on the corporate sector, because some companies already have implemented some support for employees, maybe not for all employees, but companies, very well-known global companies that support gamete vitrification for young women. They support also IVF treatments for couples or for single women. They could also support with flexible home office schemes. They could also support with flexible parental leaves or extended parental leaves. It's obviously something that is part of their social responsibility programs. And there are a lot of companies now engaging with us from the pharma sector and also from the IT companies that are interested in advocating for this. And they can support in many ways their young employees. So we think it could depend on which part of the world you're focusing, because the workforce laws can be different. But anyway, irrespective of the law, they can still do something for supporting their young employees.
I'm sure there's interesting examples of how the corporate sector is there you go, is being part of this effort around the world.
There's a lot of published data on the direct link between female employment rates since the Second World War and the number of children born. And I don't need to tell you that 80% of this audience is females. Yes, 80% here, few males. So the more women have been engaged, and I have no issue with women saying, I want to work. I don't want to raise 7 children at home, okay? But there is a balance there. And that's why Marcos mentioned what we want to do with companies, for them to facilitate a pregnancy when a woman wants to become pregnant, to facilitate investigations and some time off, to facilitate maternity leave, to facilitate a crash. Okay, how many of you here will have another child if there will be baby care at work? Hands up. Only one? Okay, maybe I didn't speak Espanol. Hablo Espanol? No. So how many of the females here will have one more child if the place you work will say, we'll give you a crash, we'll give you all the facilities, have another child? Okay, not many. Some say yes, some say no. But this is what we want to do. We're not here to force people to have another
Maybe
child.
me as well if I still had it. Oh, sure. So,
But this is the new way of looking at things needs to be, because we cannot go in and say you have to have another child just for your country. That's not right. No man, no woman will do it. But I think to telling employers that make big money, and if you look at the employment rate and the profit rate in all corporations, they go hand in hand. It's the same curve going up. And if you look at natality, it goes like that. So I think there's a responsibility for companies to actually say, we want to support families. Thank you.
yes, that is maybe the heart of this problem, right? It is still nowadays very hard to both work and build a family, and we have to be somehow magicians and take our kids everywhere. Yes, we please.
It's always amazed me that women aspire to be equal to men. But that's it's not congruent in my mind. Women by birth are above men anyway. It's the other way around. Men should aspire to be as good as women, to go to work, to come home, to make dinner, to clean the house, to put the children to bed, to bring them to football, and so on and so forth. Wow, no man can do it. And if you also say now men have to get pregnant, that will be the end of the human race. Yes.
Okay, I like the way you think, doctor. And but so please, un aplauso al doctor. Esta feminista quiere ser tu amiga, doctor. No, but it is real. We have to deal with a lot of It is a huge effort, and it shouldn't be. It shouldn't be, right? Is there anything that you would like to add about how? Yeah, about the corporate sector, please. There you go.
Thank you. So I would just probably add that it has a lot to do with education all the way from the beginning, from all of us. So governments and everyone is doing a great job convincing us or educating us to take birth control and to take care and to avoid pregnancy in adolescents or in teens and stuff like that, right? We also need to educate as well about all this and make conscious in that level as well, that we have to include information that, yes, you have to be careful now, but you have to consider that probably in the future you will need, and you need to have kids in order for us to survive as a species, as the doctors were saying. So I just wanted to add that we have to make a lot of conscience in education as well, in our teens, in our youngsters, in order to understand that this is actually becoming a problem, and it's just a matter of not getting pregnant ever, right?
Yeah, I would also support that. I mean, education in schools. We get our biology lessons about fertility, etc., but nobody knows when you're at school that at 25 a woman starts declining their reproductive capacity, even at 25 or 30. So that's a little addition to the story that has to be told in schools.
I would also add that one of the biggest limitations is access to care, especially in Latin American countries. And there's very limited support, actually no support whatsoever from the government in terms of IVF treatments. Moreover, and just echoing what just Marco said, many of our patients that we're seeing now are interested in fertility preservation. Right? It's a reality. Patients are getting pregnant at older ages, and so it's good to see that many patients are interested in this option. However, still the economics is a real challenge for them.
It has to be affordable, or
It-
government has to support it.
There has to be a way to try to support our patients. And we are seeing a few companies, corporates, that are providing this benefit of increasing for patients now, right? Very limited amount of corporates. So I think it's something that we can definitely work to strive to have them provide these benefits more frequently for patients.
Yeah, and that should be mentioned, right? So that other companies follow that. So, see.
No, I just wanted to thank everybody. This has been a great discussion, and I hope everybody takes some nice messages back to their workplaces. We have a bunch of More Joy pins for everyone who wants to support us and to tell your communities about this. So I'd like to thank Martha and Gerardo and AMMR for the opportunity for IFFS to present the More Joy campaign. It's every material that you would like to see. It's on our website. It's translated into 16 languages, also in Spanish, of course. You can download the posters, the flyers. You can go to the QR codes, fill out our survey. So if you go to our website, you will find all the materials. Thank you, Paula. Thank you, of course, Luis. You must be exhausted today, huh? Thank you very much.
She can go on celebrating her birthday, right? The birthday lady. Thank you. It was my pleasure. It was my pleasure. And as I said before, I am very thankful with this effort that you all do. I celebrate the results of your work, and I'll be celebrating soon my kid's birthday. My twins are about to turn 14. So thank you for this 14 years of unbelievable happiness. You do change lives, and you do transform families. So thank you for that.
And it's And Marcos and Edgar, I want to congratulate you for such a wonderful project. And if there's a way that we can continue collaborating, we'd be more than happy to. Thank you, Luis, for being with us and sharing your story. We are honored and privileged, and we're honored and privileged of having you, Paula. Thank you so much for taking care of this press conference, and thanks.
Thank you all very much.
Muchas gracias. Muchas gracias.